Hello and welcome to today's lecture. The topic for today's lecture is the concept of holistic health, its principles and importance. The main objectives of our topic are understanding the concept of holism and holistic health approach, understanding the concept and benefits of holistic healthcare, understanding the misconceptions about holistic health approach, understanding the application of a true holistic approach to our well-being, understanding how holistic health is practiced, understanding the basic principles of holistic health, understanding the aims of holistic health practice, understanding the principles of holistic medicine, understanding the principles of holistic practitioners, and understanding the importance of holistic health approach. Many of us grew up thinking that to be healthy just means not being sick. However, there's a whole lot more to health than we previously thought. A holistic approach to health and well-being is oriented towards supplementing guidance on how to live an optimally healthy and vibrant life. Well, first we have to start with a definition of holism. Some prefer to spell it with a W, which reflects the way it's most commonly interpreted. That one must view natural systems as wholes more than just a sum of their parts. These natural systems could be physical, biochemical, economic, linguistic, or social in nature, and therefore it has a wide range of application in almost every aspect of human endeavor. Now, what makes a practitioner holistic? Excitingly, the human body provides a perfect learning tool for understanding the practical aspects of holism. Jan Smuts, a South African statesman, in his book Holism and Evolution in 1935, defined holism in an extremely powerful way. The tendency in nature to form wholes that are greater than the sum of their parts through creative evolution. Holistic health is an overall state of wellness on all levels of individuals' being: physical, emotional, mental, and spiritual. It encompasses the health of an individual's entire being and extends to everyone and everything that affects an individual in any way. That includes his or her resources, environment, as well as relationships. Although we are accustomed to dealing with each of these areas separately, the word holistic implies the condition of the whole. In reality, the body, mind, and the spirit are completely intertwined aspects of the whole. They are not separate entities and cannot be separated. When you affect one level, either positively or negatively, to some extent you affect the whole person. Holistic health is a state of overall well-being. It's not a static thing, but an ever-changing state of being. It is the sum total of the choices you make and the actions you take, and every moment of your life, in every area of your life. The choices you make in those moments will be a major influence of your physical and mental welfare in the future. It's helpful to think of health and well-being as a continuum. What you think, how and when you eat, sleep, exercise, and relate to others moves you either further on the continuum toward good health or away from it. When you are in need of holistic healing, understanding the definition of holistic health can help you make wise, comprehensive decisions about what you need to best go about making vibrant well-being a reality. And once you truly grasp the importance of the mind-body-spirit relationship and address your personal welfare at each of those levels, you are way more likely to see remarkable healing occur. Holistic health is a philosophy of medical care that views physical and mental aspects of life as closely interconnected and equally important approaches to treatment. While frequently associated with alternative medicine, it is also increasingly used in mainstream medical practice as part of a broad view of patient care. The holistic health approach takes the broadest possible view of illness and disease, identifying multiple causes, both internal as well as external, and offering a multidimensional healing as opposed to specific cures. It's concerned with one's propensity towards disease as it is with its transmission. These include natural diet and herbal remedies, nutritional supplements, exercise, relaxation, psychospiritual counseling, meditation, breathing exercises, and other self-regulatory practices. It addresses not only symptoms but the entire person and his or her current life predicament, including family, job, and religious life. A definition of holistic health would not be complete without highlighting the fact that the wellness approaches in the holistic field are considered to be wholesome, healthy, and not harmful or toxic to the individual or the environment. They promote balance and harmony between the individual, the society, and the planet. A holistic approach encourages the individual to engage in self-care and educate themselves about their health. It urges them to be an active participant in their treatment and healthcare rather than giving all the power to a healthcare provider. In holistic health, the focus is on improving the mental, physical, and spiritual health issues through diet, nutrition, changes in lifestyle, and awareness of environmental toxins. There are a variety of holistic self-care strategies and alternative health advice intended to enlighten and empower. Being healthy does not necessarily mean the absence of disease or illness. It's about living as completely and optimally as possible with the hand you've been dealt and the limits that you face, while at the same time pursuing options that will improve your hand. When we think about being healthy, this normally means not sick. But holistic health isn't about one sole health component like diet or exercise, but rather an approach to life. When it comes to holistic health, not only the body but the mind and the spirit is considered as well. While preventing illness is important, holistic health focuses on reaching higher levels of wellness. The right half of the wellness continuum invites people to constantly explore which everyday actions work for them and discovering what is appropriate to move them toward maximum well-being. People are motivated by how good it feels to have lots of energy and enthusiasm for life, knowing that what they are doing that day will allow them to continue to feel this great for years to come. A holistic approach to healing goes beyond just eliminating the symptoms. For example, taking an aspirin for a headache would be like disconnecting the oil light on the dash of a car when it flashes. The irritation is eliminated, but the real problem still exists. In holistic medicine, a symptom is considered a message that something needs attention, so the symptom is used as a guide to look below the surface for the root cause. Then what really needs attention can be addressed. Holistic health supports reaching higher levels of wellness as well as preventing illness. People enjoy the vitality and well-being that results from their positive lifestyle changes and are motivated to continue this process throughout their lives. Although it's considered a field of alternative medicine, living with a holistic mindset simply adds balance to your life and puts emphasis on positive relationships, spirituality, and career inspiration as opposed to strictly focusing on diet and exercise. When examining your health in a holistic way, it's important to think in terms of treating the underlying causes rather than just symptoms. Finding balance is an extremely important aspect of holistic living. Striving for balance encourages you to be present in your life and forces you to actively participate in your daily life rather than allowing your days to pass you by. Holistic healthcare differs greatly from allopathic or the conventional healthcare in a number of ways. These differences do not make one right or the other wrong, But for each type of person, there is an approach that fits best with their goals and their values. A holistic health practitioner works at directing the client towards health through the following strategies. 1. Corrective breathing and hydration. Water and air are the essential ingredients of life. Oxygen is the most important nutrient on the planet, and we must get sufficient amounts, not just every day but every minute. Correct breathing mechanics help regulate the pH levels of the blood, strain on the muscles of neck and shoulders, and the effect of mental and emotional stress. Second, nutritional alignment. The use of a personalized eating plan helps to point the client toward the correct meal plan and portion sizing for their genetic type and lifestyle type. An optimal eating plan will cover much more than what to eat and when to eat, but how our eating changes over the month and year, and look at why we eat. A holistic health practitioner may use muscle testing to decipher the healing foods from the foods that hinder digestion. Blood, urine, or stool samples may also be requested to further determine a client's unique biochemical and hormonal needs. Nutrition is thus aligned with clients' needs and not the needs and desires of the healthcare professional. 3. Sleep enhancement. Growth is preceded by recovery. Hormone regulation is profoundly affected by our sleep quality as well as quantity. Many sleep challenges we face today are easily remedied. 4. Stress identification and management. Correctly identifying negative stress and managing excessive stress load through the use of Tai Chi, Qigong, yoga, and other working-in exercises. Many of the stress challenges we face today are able to be reduced with minimal amounts of energy-building exercises. And the fifth strategy is exercise prescription. The correct exercise for each client should be of appropriate intensity and volume and not overstimulate the person's sympathetic nervous system. A complete exercise program should add in mobility, stability, strength, and balance of the individual. The sixth strategy is thought and goal achievement. Every task starts or finishes within the mind. When our thoughts are aligned with our goals and dreams for life, we begin to live. It is within the mind that we start the process of thriving rather than merely surviving. The basic principles of holistic health. For years, the holistic approach to medicine was often disregarded by serious medical practitioners. Instead of using its principles to improve medical practice in general, holism was considered only applicable to alternative medicine and assumed to be unproven and unprovable. Thankfully, these times have passed and holistic medicine is making its way into common practice. Despite what some may believe, holism and the scientific method can go hand in hand. They are not mutually exclusive. The core principles of holistic health philosophy are guidelines that are designed to approach a condition from the source rather than merely treat the symptoms. The aforementioned core principles are discussed as follows. The first one is optimal health. This is the goal of all holistic health practitioners. A healthy body, mind, and spirit is what they strive to achieve for each patient. Real health is not just the absence of disease but a positive state of being. This may take years to achieve, so it is important to understand, just as Rome was not built in a day, neither will your health be. The second one is love as a healing power. This one might seem a bit far-fetched, but the main premise is that the practitioner accepts you without condition. Regardless of whether your condition was inherited or brought on you by poor lifestyle choices, acceptance without condition is the first step to the healing process. Third, the whole person. Your body, mind, and spirit are viewed as one unit rather than separate parts. Real health involves the whole person. Holistic health treats the whole person and not just the symptoms and the disease. Rather than focusing on symptoms, it is important to integrate body, mind, and spirit as one whole person. Fourth, prevention and treatment. Holistic health approaches will treat the symptoms for some immediate relief, but also seek to change some of the factors that contributed to your condition. This ensures that you will stay healthy in the future. Real health is achieved with treatment of the causes rather than the symptoms, using natural and preventive approaches to health. Fifth, innate healing power. Most of the practitioners believe that the body has all the resources it needs to heal itself. Tapping into that process is the key. Each person has a responsibility for his or her own health and must be an active participant in his or her own healing. The self is the only true healer. Health professionals can only help facilitate the healing process. It is your body, mind, and spirit that do all the healing. Sixth, integration of healing systems. The practitioner may suggest some conventional drug or surgical treatments to correct your condition, along with some prescribed lifestyle change to ensure you're healthy in the future. Seventh is relationship-centered care. The practitioner understands the need for trust that encourages disclosure within the practitioner-patient relationship. This is always a priority in the holistic care. The eighth principle is individuality. Practitioners focus on the patient who has the illness rather than illness that has the patient. The goal is to understand who you are and how you operate, since every person is unique. Once that is understood, the treatment of your illness can begin. The ninth principle is teaching by example. Holistic practitioners utilize what they prescribe. What is good for the goose is good for the gander. Now, the 10th principle is learning opportunities. All of the life's experiences are opportunities for both the patient as well as the practitioner to learn and incorporate into the healing process. Look at each illness as a lesson in achieving wellness rather than blaming yourself. Take credit for feeling good. 11. Disease is not bound to happen. Often, disease is a symptom of body's inability to return to balance. It can be overcome with a willingness to manage and eliminate the abuses and maintain a disciplined adherence to a reasonable balanced diet of whole foods, a regime of proper foods, exercise, rest, and permanent life-changing habits can bring a variety of positive effects. 12. Let the food be the medicine and medicine be the food. When Hippocrates uttered this oft-quoted profound statement, there wasn't the problem of preservatives, food dyes, chemicals, and fast food that plague our modern diet. Today, he would have said, let the food as God made it be the medicine, and the medicine as God made it be the food. 13. To change the way things are, you must change the things you do. Everyone will have gaps in their diet, their exercise, and rest. So don't despair. Make a few changes and get on with your life. For example, if you can't eat everything you need to become and stay healthy, simply fill the gap in your diet with a well-designed nutraceutical program. Now, 14th is, it isn't over till it's over. The effect of particular conditions largely depends on the degeneration of the body and its vital organs. However, the body is resilient. If sufficient life energy remains and you have the will, the possibilities for rejuvenation are good enough to warrant a change. 15. The body contains an energy system that underlies and enlivens the physical body. The body has an inherent wisdom to heal itself through its natural, physical, and spiritual dimensions. That healing system inherent in the body and mind are set in motion to bring true enlightenment through using of methods and techniques that are in harmony with body's natural processes. 16. Mind and body are integrated and inseparable. When we think of the mind, we naturally focus to a mental state that is achieved by focusing one's awareness on the present moment. We assist in reaching into a deeper level of thinking by opening up the mind to receive its true sense of being while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations. This technique helps each person understand and begin to feel a calm, surreal, gentle state of being that allows a fulfilling sensation called inner peace, harmony, and contentment. 17. Holistic health includes the spiritual element of an individual. Spirituality has been defined as a process of personal transformation. It refers to meaningful activities that result in blissful experiences. A big part of holistic health is the understanding that all parts of human body work together to maintain overall wellness. As mentioned above, this includes a spiritual component as well. Holistic health practices recognize that for some individuals, dealing with illness or pain can relate to spiritual concerns that may result in physical or emotional symptoms. Instead of only curing the physical ailment we are experiencing, holistic health takes it a step further and addresses the emotional side of the equation, for example, surrounding an individual and their family with mental comfort and support. Number 18. Positivity is empowerment. Negative thinking strips you of power and control, whereas positive thinking empowers you with answers, control, and the way out of illness and problems. All things are composed of equal amounts of positive and negative aspects. In everything there is a blessing. 19. Wellness is an active process. Do not wait for good health to happen or be dependent on someone else to fix your problems. You must be actively involved in your health in order to achieve wellness. It is important to ask and learn from your healthcare provider. Number 20. Wellness is outcome-oriented. Do not become trapped by focusing on problems alone. As soon as you identify a problem, put your energy into the solution. Number 21. Prevention eliminates the need for treatment. It takes very little time, money, and energy to prevent problems. Truly, an ounce of prevention is worth a pound of cure. Now you understand the guiding principles that holistic healthcare uses when it treats you. It is comforting to know that these rules of practice are things they take seriously. The guidelines make the patient the focus of the treatment rather than focusing on the method of treatment for the patient. By doing this, they ensure that your health and well-being are paramount and remain the focus of your relationship with them for years to come. Talk with your practitioner about their area of expertise and what their focus will be for treating your illness. Further, there are various principles and guidelines that help the healthcare practitioners treat their patients, which are as follows. The principles of holistic health practitioners are: 1. Do no harm. First and foremost, the holistic health practitioner, or HHP, does no harm. The HHPs do not diagnose disease, treat disease, prescribe drugs and pharmaceuticals, or perform invasive procedures. Second, healing power of nature. The HHP understands that the body has an innate capacity to heal itself. The healing power of nature is the inherent self-organizing and healing process of living systems which establishes, maintains, and restores health. 3. Teach health. Client education for lifestyle changes and self-care is a very important part of HHP's practice, and they continually work toward the personal incorporation of the principles of holistic health. 4. Eliminate the cause of poor health. The HHPs strive to determine the underlying cause that contributes to a health issue rather than merely managing the symptoms. Taking a holistic approach that relieves symptoms, modifies contributing factors, and enhances the patient's life system to optimize future. 5. Prevention. Promote health, prevent illness, and help raise awareness of disease and imbalance in our lives. 6. Honor the whole person. The HHP view people as unity of the body, mind, and spirit, and the systems in which they live. 7. Know the client. The HHP expends as much effort determining what kind of client has the problem as they do determining what kind of problem the client has. 8. Form quality relationships. The quality of the relationship established between the HHP and the client, in which the client is encouraged to take responsibility for their own health, is a major determining factor in the healing process. 9th, clients are important. The HHP considers the needs, desires, awareness, and insight of the client as well as their own. 10. Set an example. HHPs continually work toward the personal incorporation of the principles of holistic health, which then profoundly influence the quality of the healing relationship. 11. Every experience is a learning experience. All life experiences, including birth, joy, suffering, and the dying process, are profound learning opportunities for both patients and healthcare practitioners. 12. Evoke the positive and release the negative. HHPs encourage their clients to evoke the healing power of love, hope, humor, and enthusiasm, and to release the toxic consequences of hostility, shame, greed, depression, anger, grief, and fear. 13. The healing power of love. Unconditional love is life's most powerful medicine. The HHP strive to meet the patient with grace, kindness, acceptance, and spirit without condition. 14. health is more than the absence of illness. The HHP is aware that optimal health is far more than the absence of illness. The state of optimal health includes the pursuit of the highest qualities of the physical, environmental, mental, emotional, spiritual, and social aspects of human experience. Now we'll discuss the various reasons which make holistic health approach important. The most important reason is that it takes the whole person into consideration. Western medicine often focuses on treating symptoms as opposed to always trying to determine the underlying causes of a condition, which is the focus of holistic medicine. The American Holistic Health Association, AHHA, describes it this way. Rather than focusing on illness or specific parts of body, this ancient approach to health considers the whole person and how he or she interacts with his or her environment. It emphasizes the connection of mind, body, and spirit. The goal is to achieve maximum well-being where everything is functioning the very best that is possible. Mind, body, and spirit. These aspects of each patient are considered to be intertwined and essential to achieve optimal health. It focuses on natural healing. While holistic medicine may incorporate treatments from mainstream healthcare, drugs and surgery are not the first line of defense. Some of the focuses of primary care treatment in holistic medicine are diet, exercise, environmental measures, attitude and behavior modifications, relationships and spiritual counseling, bioenergy enhancement, etc. By definition, holistic medicine is about lifestyle changes, non-invasive remedies, and improving the flow of a person's life force energy along with enhancing the body's own ability to heal itself. It is patient empowering. Holistic health is a lifestyle. It does not stop and start when you walk in and out of a practitioner's office. What the patient does on a daily basis to tend to their mind, body, and spirit is as important as any treatment or herbal remedies they receive. According to the AHHA, holistic medicine teaches patients to take responsibility for their own health, and in doing so, is cost-effective in treating both acute and chronic illnesses, therapeutic in preventing and treating chronic diseases, and essential in creating optimal health. Many people opt for holistic medicine because it's a way for them to feel empowered in their own healthcare. They do not have to wait for drugs to work or surgery to fix them. They can take measures to enhance their well-being on their own. Real relationships. Most holistic healthcare practitioners develop a real healthcare relationship with their patients. This is often due to the abundant amount of communication that is shared to get at the root of the issues. Clients are typically advised to come into a good relationship with themselves, including doing good for their mind and body. Many do find this as a much more effective healing process compared with what they typically receive at other healthcare facilities. Many therapies. Patients will typically have full access to traditional medicine therapies with a holistic nurse, but they will also be open to a world of other therapies as well. A few of those options include reflexology, homeopathy, yoga, hypnotherapy, Reiki, nutritional supplement therapy, as well as things such as meditation, music, and dance therapies. All ages are treated. Many professions tend to focus on a single age group or a type of illness. Holistic health professionals typically treat people of all walks of life. From a newborn baby to an elderly patient, all types of people with different concerns can be helped through numerous therapies and options. This is important as well-rounded views are often best when it comes to health. That's all for today's lecture. Hope you enjoyed it. Thank you very much.